Is there a permanent treatment for erectile dysfunction? Yes, it's there. It's penile implant surgery. I know the moment you hear a word surgery, most men are scared. That's natural. But we have seen many men who have gone through all sorts of therapies, all sorts of lifestyle changes, but still haven't seen any improvement, and their marriage is in trouble, and also their parents are asking them, and also they're having difficulties in conceiving as well because they're not been able to have a good sexual life. So a simple erectile dysfunction can lead to so many issues. When the lifestyle changes are not helping, when the tablets, penile injection, vacuum erection device, shockwave therapy, low intensity shockwave therapy, none of these are working, you have controlled your sugars, you have done good exercises, and you have maintained a healthy diet, still nothing is working, then penile implant surgery is one such solution, which is a permanent solution for your erectile dysfunction. And penile implants, there are two types: inflatable penile implant and the semi-rigid or the malleable implant. In India, since many of the insurance companies do not cover the penile implant surgeries, the most common type of implant that is done in India is the semi-rigid or the malleable implant. Inflatable implants are slightly expensive, hence most men prefer a semi-rigid or a malleable implant in India. See, if you calculate the cost of the penile implant, for example, the cheapest implant, including the total surgical cost, may be around 1.8 lakhs to 2 lakhs. If you calculate the cost of this 2 lakhs, the penile implant cost, and if you actually calculate the cost of all the medicines that you keep taking repeatedly, the number of clinic visits or the hospital visits you do, the number of work hours lost, and also the number of tests that you undergo, if you calculate all this, in fact, a penile implant may become a cheaper in the long run. If you think in the long term basis, a penile implant may be a good option, in fact a very better cost effective option. It's just like comparing between a kidney transplant and the dialysis. If a person is fit and if somebody is ready to donate the kidney as per the rules of the Transplantation Act, a kidney transplant becomes much cheaper in the long run if you think as against the dialysis. Similarly, a penile implant may be a cost-effective option when compared with the repeated tablets, repeated tests, repeated hospital visits that you have to incur to get the erectile dysfunction treated. And you will have to be taking the tablets for a very long time. For example, if you're 30 years and if you want to be sexually active till 60, 70 years, to those 30 years, calculate the amount of money that you spend on all these medicines and the tests. So penile implant is one such option. And the semi-rigid implant, since there is no much hydraulic mechanism involved in that, these implants do last for a very long time, maybe 25-30 years also, and the complications rates are quite less if it is done by an experienced andrologist. So do think about the penile implant option if none of the therapies are working, and it's quite safe, and of course most men are happy after a penile implant surgery. In fact, the satisfaction rate of men who undergo penile implant surgery is more than 90%, and the satisfaction rate of the partner or the wife is above 80% when a husband undergoes a penile implant surgery. So please do explore the option of penile implant surgery.